muscle tumors in general are divided into 3 groups. They are graded, like grade 1, 2 and 3. And we know that there is a difference in the ways we treat these tumors. Especially the high grades, so the grade 3 and the bad grade 2s, they need to be treated after surgery, or when they are not being able to cut out by a surgeon with medicine, with drugs. And so far we used chemotherapy or corticosteroids. We used finlastin, we used lomestin in these dogs, and well, a lot of those dogs respond favorable to these treatments. Gizmo had several mast cell tumors in the skin, which in the beginning didn't look so severe. So surgery was not an option, and we decided to start treating him with chemotherapy. And when we started, it became very clear that the tumors didn't respond. So we used several kinds of chemotherapy, and we used prednisolone, and only new tumors started to develop, and the old ones started to grow. Finally, in December, there was so much bleeding that it has to be stopped with bandages. There was no response to any treatment, to high dose of prednisolone. And finally, just before Christmas, decision was made that he should be euthanized because of tremendous blood loss from one of the big tumors. And just to show you that everywhere where you see this kind of areas without hair, there were mast cell tumors from 5 to 6, 7, 8 centimeters, and I think there were between 50 and 100 tumors all over his skin.
It was in May that we discovered that Bo had a little bump here in her lip, but we didn't know how it came there. We thought she had a bee or something like that, and everybody said, oh, that's nothing, it will decrease and reduce in like 2 days. But it stayed there, and we didn't know what to do, so we went to the veterinary in our local town, and she said Bo has cancer. And we thought, oh no, not Bo, because everybody knows somebody who has cancer, and the main results are bad.
Always when there is a new drug, you test it on your worst patient. So we had a really worst patient who has a lot of skin tumors, mast cell tumors. Tumors were not responding anymore to chemotherapy. The dog lost a lot of blood and was really at the point of being euthanized. And at that point we decided to ask for Masivet, because we knew that for this dog there could be a chance that he could be rescued by the drug.
Everywhere blood, and I can't stop the blood. So yeah, I thought it was the end for Gizmo, but now it's very happy and alive, and I am happy. I'm very happy that Gizmo is feeling great. It's the old dog, the same dog as 6 months ago. So this is him.
In October, November, about that time, she had her final chemotherapy, but the tumor increased in size, so it didn't have any effect anymore. And we went to Johan, but he said, yeah, we tried like everything, so you can do things, but it won't remove the tumor anymore. And yeah, then came Christmas, and we were very sad because Bo was getting ill, and she didn't eat anymore. Her tumor grew, especially here. We couldn't walk with her because this was too little. And yeah, she was very ill. She didn't want to sit with us anymore. We talked to Johan at the 4th of January, and he said, now maybe there is hope, maybe. I can look for you if we can arrange something. And Johan called us, and he said, I have very good news for you. She can start right away. And the moment she started, the tumor reduced. Already the second day, she saw major results, as well in her neck, but especially in her lip. And 6 days later, it was almost like there was a gap in her lip. When you did this, you could really see through it. So it was very strange because we thought, is this good? Is this not good? But we went to Johan and he said, wow, it's very good. You must be very happy. And yeah, everything started to be normal again. And now she's like the old girl.
What is really remarkable, what is astonishing so far is that Masivet is working in dogs who were, and in tumors who were not responding, mast cell tumors who were not responding anymore to chemotherapy. And I think that's really a breakthrough, because so far there was no hope for these animals anymore. And at the moment in oncology, it's in veterinary oncology or human oncology, when you're not able to create complete remission, creating a stable disease can also be considered as a successful treatment. So probably Masivet will be able to create stable diseases in those dogs. Regarding the tolerability, so far we did treat 8 dogs with Masivet, and we didn't see any side effects of the drug at all. There were a lot of blood exams done. Owners were asked to phone us on a regular basis whether there were no gastrointestinal side effects or other side effects, and so far we didn't see any side effects. The results of Masivet treatment in this dog are really dramatic. We started at the point, in fact, where the dog was in veterinary hospital at the point of being euthanized. We convinced the owner not to let his dog put to sleep, and he started the next day with Masivet. And 3 days after that, we already witnessed that tumors were drying up, some were really falling off his body, and the dog was recovering very, very fast. So the results were really dramatic. And in 1 day, in 1 week, 14 days, all the tumors had disappeared. And there were really hundreds of mast cell tumors on his skin.